The World Health Organization's chief is in India even as the government pushes back against a report prepared by the WHO on exactly how many people have died from COVID in India and around the world. I'm Barkhadat, you're with the Mojo story. In moments from now, we'll be talking to a key epidemiologist based out of Toronto, somebody whose own independent research tells us what we already know from our extensive reporting on the ground. There is a dramatic gap between the official death count during the pandemic years and the actual number of Indians who may have died. And that could be a difference of at least four times, if not much more. The World Health Organization's report on these COVID deaths is being pushed back against by the government that has questioned its methodology. Some media reports have suggested that the government has implored the WHO to place this report in abeyance for a few years, maybe even 10 years. Why is India pushing back against the World Health Organization's report on the COVID death count? And what do the multiple surveys and research studies that have been done into this tell us about how many millions more, and I say that word with some responsibility, may have died from COVID than we know? Well, let's go across today to well-known epidemiologist, Professor Prabhat Jha, whose own study in this area points to a dramatic gap. But Professor Jha is also a member of the technical advisory consultancy group that reviewed the WHO's report that currently has not been placed in the public domain. Thank you very much, Prabhat, if I may address you such. Let me start by asking you to talk a little bit about your own findings. I'm familiar with your report. I also traveled across India during these 2 years, finding mass graves of uncounted bodies along the riverbanks of the Ganga. So I have some sense of what you're talking about. But if you had to explain it to a larger audience in India, what would you say?
Well, I'd say simply that the underlying problem is that many deaths in India are simply not registered. India has about 10 million, 1 crore deaths a year, and routinely 3 million of those are not registered, and 8 million don't have a proper death certificate to know the cause of death. So this was a long-standing problem. Along comes COVID, and it has in particular months, a huge increase in deaths. And everyone knows that. Everyone remembers how bad, particularly April, May, June of last year was right across the country. So in the absence of good government routine data, we relied on 3 data sources. First, we did a national survey working with C-Voter, which is a credible polling company, which took a random sample of Indian homes and called them and said, have you had a death in the house? And second, and that showed approximately at the peak months, well over 4% of houses reported just a death from COVID. As comparison, any house, if you look at the numbers of houses that should have a death, it should be about 3%. Over a year. So we effectively, in those months, the death rates doubled just in those months. That was the first survey. The second data source we used was the Government of India's own hospital data, which tracks 2 lakh hospitals all over the country. And that showed also a similar increase, roughly a 30% increase. And it showed, as we all suspect, in the second wave in April, May of last year, that the rural areas were affected, not just the urban areas, which was in the first wave. And finally, the third data source we used was the one that WHO is using, which is the civil registration data. But we restricted it to just 10 states that had more than 10 months of observations. So our findings are pointing to between 3 to 2 to 3 to 4 million deaths. I understand the WHO estimate is about 4 million. And I think the key point, Barka, is a scientific one, which is all the studies, when put together, our 3 studies, the WHO study, what Arvind Subramaniam has done using another data set, and Anup Malani has done using yet another data set, they all point to a substantial undercount of at least 5-fold. So we're not looking at 500,000 deaths, but at least 2.5 million, at least, and perhaps up to 4 million. So I think that's the scientific consensus. The second point, and I'm glad you raised this, is a very sensible one. If your viewers simply go and ask the unpleasant questions in their neighborhoods, saying, do we know 10 houses? And ask, well, in them was a death in the last year and in the previous years. Typically, you'd only have roughly 1 in every 30 houses reporting a death a year. And I'm sure your viewers, if they just asked in the houses that we know, among friends, in our neighborhoods, in our gully, how many houses had a death? And they would show it's much, much higher than that baseline figure. So common sense also suggests that India's death total was far, far greater than the official numbers.
I'll come to the WHO study in just a moment, and I know you're part of the consultant advisory group that had a chance to review that report. But let me just share with you what I found when I was traveling.
Mhm.
I would go to villages, during the surge of the second wave, and I would ask literally in every hamlet exactly what you just said. Have you noticed many? Have you documented many more people dying in this village than, let's say, the last year? And literally every village I
Mm.
went to, whether it was Tamil Nadu or whether it was Uttar Pradesh, would say yes. And they would then lead me to homes where people had suddenly died at home from a
Mm.
sudden short-lived spike in fever.
Mm.
Cremation grounds were full in rural India. We saw, as I told you, along the Ganga, bodies that had been thrown into the river as well as abandoned. Some because people did not have money for wood for cremations, others because of stigma. And then finally, if you did not have a COVID test, it didn't matter how you
Mm.
died, when you died, you would not be counted as a COVID death. And I'm not even getting right now into the oxygen shortage deaths or the deaths that took place from other diseases during the pandemic, like TB or kidney failure because of access to a hospital. So I'm wondering if your surveys actually look at all of these multiple factors. Your studies looked at all of these. What about oxygen shortages? We don't even acknowledge those deaths.
Yeah. What we found particularly in the Sea Voter survey, is we did a second survey, a more detailed survey, and asked if the houses could describe the cause of death very broadly. Now, hospitals aren't doctors, so they won't know the complete diagnosis. But interestingly, there was an increase not just in deaths that were reported as COVID, but also as non-COVID deaths during the peak months of April, May, June of 2021. And that makes sense because we know that COVID the virus doesn't just kill from an acute lung infection. It can also cause strokes and heart attacks and kidney failure and sudden death, that people will suddenly have a blood clot and die. So that's very consistent with what you're reporting in terms of talking to people in the field.
Yeah. Let me ask you this. If you had to pick up a central set of factors that has led to this undercounting, and let's also say the undercounting is global,
Mm.
even the United States of America, there's a debate around unclaimed bodies, and there are mass graves even there that were reported on by the media. What would be those key factors in India? There's also something we haven't spoken about, which was the bureaucracy that a family had to go through to get a death certificate. There were states I reported from where the administration actually ordered that the cause of death should not be placed in or named or tabulated in the death certificate.
Yeah, those are the underlying problems that existed before COVID. So it's not easy to get a death certificate in many states of India. And in the rural areas, bodies are simply disposed of. They're cremated or buried very quickly before even any kind of registration can occur. So I think that's the underlying issue. On top of that, what you have are two things. One is governments were absolutely frightened and they did not know what to do. And in that consequence, it's a natural reaction, regardless of political party, for the politicos to tell their officers, look, don't give me any more problems. We're in a bad enough state already. And so this very much encouraged underreporting or ignoring of very much likely COVID deaths. And the second, quite frankly, is, as you know, all government services during particularly the second wave were so affected. The people who work in the government themselves were sickened and they were at home. So you had a short-term collapse effectively of what's supposed to be government functions. So I hope the tragedy and the heartbreak that occurred in the second wave simply doesn't occur in any other population. And this is what it comes back to, that if India would improve its systems for recording deaths, then in the future, you would know exactly what is going on and you'd know it early. So in our report, we've tried not just to say what went on, but what could go on in the future, which is to try to improve these simple systems that now many other countries have at 100% coverage and reasonably good coverage.
Yeah. Before I get to that and look at prescriptive approaches to the future, let's talk about what's happening with the World Health Organization
Mhm.
and that report on COVID deaths that you've had a chance to review. The government here, as you know, is pushing back against the release of that report. It has questioned the methodology used by the World Health Organization. It has made a couple of arguments. One is that India, a big, diverse country of nearly 1.3 more than 1.3 billion people, is being clubbed with very small countries. Two, that the data is not drawn from all the states, it's drawn from a select few states. And this extrapolation of the statistical model used by the WHO is not one that the government is buying into. You would say what, since you had a chance to review the WHO report?
Well, I think the details matter here. So the WHO report, as far as I understand, I haven't seen the full report, I've only seen a presentation of it, has used data from 17 states using the government's own civil registration data. And they've used the excess of those deaths that are recorded in those 17 states to make estimates for the remaining states. So it's not quite true that this is a model created from countries overseas that's been imposed on India. The model has some broad parameters of how many deaths to expect on particular days, for example. And that has been applied to the large numbers of deaths from India. They used more records than we used, for example. They used 17 states and we used 10 states. And they point to a remarkable excess that's very consistent with other studies. And you have to remember that all science is uncertain. Every study has limitations, including ours, but the totality of all the studies points to the right conclusions, usually. And here, the signal, the numbers of deaths that was so large that even if you had a crude system, you would still get about a reasonably accurate answer. So we've got to be prudent and cautious, but very much making the point that large numbers of deaths occurred in India, and it was very obvious, and various data sources show that. The only data source that is not consistent with that is the government of India's own COVID reported deaths. And these are the ones that estimate 500,000. But we know, as you've pointed out, those are only deaths that had a confirmed COVID test. So unconfirmed tests usually aren't included. The World Health Organization guidelines say when you're making national totals, you should include not just tested deaths and confirmed COVID cases, but also suspect deaths. Think that someone as you described, someone in a home died of an acute fever and a lung infection within days. And 3 days later, the brother or the brother-in-law or the sister-in-law in the same house died in similar situations, but wasn't tested. How likely is that not to be COVID? Well, very
Yeah.
unlikely.
Actually, there were homes in rural India where that first death would take place without a test, and the second fatality would be a test. And He might be counted, but the brother was not, even
Right.
though the sort of normative evidence told you clearly what had happened.
Yeah.
But let me just give for a moment the other side of the argument,
Mhm.
though I don't agree with it because I witnessed these mass deaths and sort of the invisibilization of these deaths myself in the heartland of India. But the counter argument, Professor Jha, might be if 500,000 is the official toll, and all estimates suggest at the very least that 2 million deaths actually took place. And as you said, maybe double of that, maybe about 4 million in India itself. Where do you hide, or how do you hide millions of deaths? Because after all, the surges were finite. They were 2.5 months in both waves. It's not that they dragged on over a long, lengthy period of time. They were 2 to 3 months maximum. A lot of people, even those who have been critical of the government's handling or the counting, are not convinced of the scale of the WHO, at least what's leaked into the public domain, because they're like, where do you hide millions of bodies? How do you hide millions of bodies?
You don't hide them. As you said, for the acute, for the worst weeks, uh, the uh, burial grounds and the crematoriums were backed up. So bodies were eventually disposed. In rural areas, people would simply cremate out in the fields without any kind of record. And that's very much what has happened. That's been well documented. And I do take the Indian government's criticism seriously that they say, well, these methodologies have limitations. But I come back to a solution which is at the end of our paper with two clear recommendations. If the Indian government does believe that the death totals were lower, then what it can do, most importantly, is in the 2022 census, which is coming up in September, it can add one simple question. Was there a death in this house from January 2020 onwards? And if so, what was the age, sex, and date? And that would give you a direct accounting of the deaths. And now, if that was done, and it showed a much lower total than our estimates, I and other scientists would be willing to revise our estimates as to what actually happened. So I think the best way forward is, rather than arguing about methodologies, is for India to use its normally extremely well-functioning census to answer this really important societal question. The other thing that can be done is India has a very good sample registration system that takes about 1% of the homes in India and surveys them, but that has not reported any data from after 2018. So it again can release those data. And given the scrutiny, I think it's important to also have public confidence in the data. And you have to remember, thankfully, India doesn't have much vaccine hesitancy, but if governments aren't straight with people and people don't believe the government data, then they're more likely to doubt, well, is this vaccine actually safe for me? Why should I take it? If the government is lying about one thing, they'd be lying about another. So as a matter of public confidence and moral accountability to the enormous numbers of people who died tragically, I think it is important to get an estimate. And I can think of no better solution than to put a question on the Indian census in September of this year.
That's a great suggestion, but it's also important to contextualize that this undercounting is a global phenomenon, and the
Yes,
World Health Organization's report
absolutely.
is actually talking. You've spoken about a factor of five that explains the difference or captures the difference between the official toll in India and the actual numbers of death. What is that factor globally?
Well, the official global estimates, based on what governments compile, is about 6 million COVID deaths to date. And that's then put together by WHO. The WHO estimate, as I understand, is around 15 million. So there's a gap of 9 million. So approximately 3 million of that gap, that extra 9 million, comes from undercounts in India. But close to a full million might be coming from Russia alone. Then you add in a few 100,000 from other parts of Asia, including Pakistan and Bangladesh and Indonesia in particular, and then undercounts from Brazil and so forth. And you, if you're trying to say what accounts for that 9 million extra deaths, well, those countries put together would easily lead to accounting for more than half of that gap.
And
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 then
and
other
and,
countries.
and you believe that 3 million of the global gap in the count right now could likely be from our country, India.
Yes, yeah. I think that's because of the consistency of those estimates. I think that's a reasonable estimate.
And again, in the end, you believe that these are not lives that have to be lost in a black hole of little information or the absence of transparency. That if the census were to update a question on recent deaths, then using what the benchmarks of excess mortality, and I just want you to very simply explain to our audience, epidemiologists use this
Yeah.
phrase all the time. uh, just if you had to say it simply, it basically means all the people who died from any cause in a year compared to the previous year, or how would you describe it?
Excess mortality relies on really short time periods. So what it says is during the particular weeks of the pandemic, were the numbers of deaths from all causes greater than they would have been, for example, in non-pandemic months. So you can compare um, May and June of last year, or April, May of June of last year, to, for example, July, August of last year, or you can compare it against May, June of 2019, prior to the pandemic. So it's really short term comparisons of how many overall deaths. And the logic is COVID doesn't just kill from an acute infection. To die from COVID, you don't need a death certificate. You don't need a test. You have to remember that COVID testing is something that government has as a requirement for certifying COVID deaths, but COVID can kill you without a test. And
Yeah.
the if you compare those weekly data to the previous weeks and see the excess, it's a very simple, transparent way. And again, I would say if your viewers would be willing to just go and talk around their neighborhood and ask in 2019, 2020, and 2021, how many deaths occurred, how many houses had a death, and you'll find that large numbers of houses had a death, and that much of that was concentrated in the April, May, June months of 2021. So anyone can do epidemiology if you do it sensibly, and the numbers here are so big that it should be obvious to everyone that the government totals are not trustworthy currently.
Will we see this World Health Organization report in public despite, you believe, the severe pushback from India?
I believe it's the WHO's moral responsibility to produce this report, and you also remember that the who is WHO accountable to? It's actually accountable to the world's health ministers. There's a formal mechanism with the World Health Assembly, and the World Health Assembly, which is all the health ministers of the world, have called upon WHO to release data, and that's already been passed. India voted on that, so there's a legal and a moral obligation for WHO to produce numbers, even if governments are not comfortable with them. And I do give credit to Dr. Tedros and team. They have reached bent over backwards to try to accommodate the Indian objections and incorporate them and give time to vet the numbers. They didn't simply do a brazen press release and say, here's the numbers. And that's good leadership. So you do want. The pushback from the Indian government is understandable. Many governments are reluctant to go and review what was a really dreadful time for many societies. But India is a bit unique in that it has almost categorically rejected the estimates and has tried to argue that they should not be released. But other countries, I don't think, will play ball. They want these numbers out.
Well, I always say that we tried so hard in our reporting that those who died should not be a mere statistic. But we're now at a point in this conversation when we're asking that at the very least they should at least be a statistic, which is somewhat of a tragic irony for this horrible 2 years that we have gone through collectively. And I think that to not acknowledge those who have died is really something that is egregious morally, and I actually welcome a healthy spirited debate on the methodology, and I wish the government would lead one instead of actually stopping this report from coming. Thank you, Professor Prabhat Jha. We've been looking at your work very, very carefully, learned a lot from it, and we hope to have you back once this report is in public. There'll be a lot more to unpack then. Thank you for making the time, and see you soon.
Thank you.
Bye-bye.
Bye-bye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalists.